Distinguished participants, welcome to the session on disability assessment, identification, and information systems. This session will present good practices and lessons learned from different countries that have made notable achievements in enhancing their disability assessment mechanism and information system. To provide specific services required by persons with disabilities across the life cycle, social protection systems have to identify and assess the support needs of persons with disabilities. Disability assessment mechanisms and related information systems serve as the foundation for effective policy planning, eligibility determination, and case management. In view of the diversity of persons with disabilities, disability assessment has been a challenge in many countries. It often focuses on assessing impairment rather than the set of functional difficulties, support needs, and barriers faced by persons with disabilities. In addition, it is also challenging to develop context-relevant mechanisms that are reliable, transparent, and accessible to persons with diverse disabilities. In this context, I'm very pleased to moderate this session that look into solutions to address various challenges. My name is Chai Chai. I'm Chief of Gender Equality and Social Inclusion with the United Nations Regional Commission, ASCAP, based in Bangkok, covering the Asia Pacific region. During this session, please feel free to type your questions in the Q&A features, and our panelists will try to address them as soon as they can. In addition, if you have any technical issues, comments, you may also use the chat box. Finally, I want to mention that this session, maybe next slide, just to mention, the session is supported with various accessibility features. Can we move to the next slide? Yes. So we have sign language interpretation, as you have seen, and live captioning, which are available. And in addition, we also have interpretation available in French, Spanish, Arabic, and Russian. And the slides shows how you can control through your Zoom functions to choose the language you may need. So with that, I'd like to invite the speakers for this session. First, I'm pleased to invite Mr. Alradi Abdallah, representative of the International Disability Alliance, to present critical issues on disability assessment and identification raised by OPDs. Mr. Abdallah, please, the floor is yours.
Thank you so much. Hello, everyone, and welcome to this session. So as we all agree that there is no doubt disability assessment is really critical for the social protection. However, there are some points that we need to take into consideration. The first point is that the disability assessment should not only focus on medical assessment, rather it should also capture other factors that has impact on the participation of persons with disabilities. For example, the disability assessment should also assess the environmental barriers, the difficulty, the functional difficulty that persons with disabilities have, and the support required by persons with disabilities in order to participate. Also, the disability assessment should be accessible, simple, and reliable. And here we are talking about the accessibility of the process itself, the accessibility of the information about the assessment system, the accessibility of physical accessibility. We mean that the building itself should be accessible, should be located nearby persons with disabilities live. And also we need to make sure that there is no complicated process and back and forth stage of the assessment. And we also need to make sure that the disability assessment should not lead to reinforce the stigma around disability. And moreover, while we are doing the assessment, we obtain a lot of data. So this data should be used further to support persons with disabilities. So this data should be used, for example, for eligibility criteria, but as well as for the case management, especially during crisis, as we saw in the COVID-19, where persons with disabilities, they need to be allocated, and we also need to know the support that required by them. And this data should be a great resource to do so. However, while making good use of this data, we need to make sure that we are not undermining the privacy and confidentiality of this data. Also, this data could be useful for policy planning and policy and budget planning in order to have a good idea about how many numbers that we have and how much they need. And finally, in order to have all that, we need a system that is well functioned with a digitalized system and that integrated to the national registry in order to make sure that this data is well kept and well used, and there is no undermining of any aspect that I have mentioned. Thank you so much.
Thank you, Mr. Abdallah, for succinctly bring to us a set of important concerns, especially when we are designing the system and mechanism for disability assessment. Very useful. Thank you. With that, now let me invite 4 speakers who are going to bring us examples and experiences from 4 countries. First, I would like to invite His Excellency Mr. Boris Samhen, Secretary of State at the Ministry of Social Affairs, Veterans and Youth Rehabilitation, Cambodia, to discuss digitalization and disability assessment for greater access to social protection in Cambodia. Mr. Boris, the floor is yours.
Thank you, Ms. Chai, and just like to take this opportunity to thank the team organizing this platform. I thought this is such a great platform for us to lead up to the future of inclusion for our disability people. So this is great. So I will take this opportunity to share a bit about what Cambodia looks like. Next slide, please. So Cambodia is a country of 15 million people. After our census in 2019, we come around 4.9% of people with disability in Cambodia. So this is a country that came out of landmine war, civil war, 40 years. Still we have 4.9% left. But however, while we are having this amount of number, we're able to start launching our disability MIS system, and we're able to register about 237,000. So that's probably about 1/3 of the total amount of the 4.9%. And even right now, we have about 67,000. That's about further about 67,000 people are receiving cash. And if you look at the number here, we have about 22,000 of children that are under 18. And we also have the divide here. So this is how Cambodia looks. So next slide, please. So in order for us to start tackling issue in social protection with inclusion of people with disability, we went ahead at two documents that was needed. One was the social protection policy framework that was established in 2016 that allow us to have space to expand coverage in terms of allowing cash transfer support for people with disability. Second is the law on the right for disability people. So that was established in 2000, and later on we did an amendment in 2021, just about earlier this last year, that allow more person to come in and fully recognize their right to social protection. So by saying that, this is what it looks like so far. So next slide, please. So before 2021, you see the number earlier about at least about 700,000 people with disability in Cambodia. And before 2021, we have only about 16,000 people are receiving support in terms of cash transfer from our system. But however, throughout this COVID-19, it was lucky that Cambodia we took a step further earlier, and about 10 years ago. We have launched something called the ID pool identification system throughout the country. So we divide 1/3 of the country. We did a random, not a random, every year we would go to 1/3 of the country to do an identification for poverty, people in poverty. So we keep updating this for the next 10 years. And what we got back was people that were registered in the database, about 400,000 family. And when the COVID-19 hit, we were able to expand the identification for poverty to see and reach out all the way to 700,000 family. From within the 700,000 family, we were able to find out about 67,000 people that were with disability. So about 10% of the total population in the poverty and household that are poor. While we having this, what we were able to do, we were able to create a system where we allow the cash transfer to go to this household. So just over the last 20 months, I think this is the biggest ever Cambodian support program in terms of $500 million we're spending in terms of cash transfer to all these households. Next slide, please. So while we were doing this, we also recognize the shortcoming in terms of our disability database. We know that after census of 2019, there were 200,000. There was about 4.9%, which equal to about 700,000 people with disability in Cambodia. So we only able to register right around 67,000 at the moment. What we did, we start to renovate right away, design a program just early 2021. About a year, we able to set up a program where we allow digitalized system with the service available to 1,650 commune. And this is all commune in Cambodia. And commune in Cambodia, the level of functioning administration here, we only have national level, provincial, district, and commune. So commune would be just the lowest administration office that available. So all commune was actually trained to actually apply this database. They all have to learn to use their iPhone to enter data, that these data connect right back into our national server, where all the national server is the department in our ministry is the one that do approve. So if you look at the picture here, we would go through the process of case management and status update in the built into on-demand system. With that, we engage over 4,900 trained commune worker and look into social and environmental dimension and determine the 3 levels of disability. With a strong collaboration with the grassroots and CSO and the DPO. And from that, with the interministerial coordination and monitoring structure, we issue this ID card in the end for them. And at the moment, like I mentioned earlier in the PowerPoint, there was about 237,000 people with disability that have issued this card for them, and continue to improve very fast. I think within the rate that we are doing, likely we should be able to include all the 700,000 by the end of this year. The next slide, please. So with this database available for us now, we are looking to interlink this database with the ID pool system, where this ID pool now, because of Cambodia, after the COVID-19 response phase out, there will be a phase out period where we're only looking to provide cash transfer to a poor family. So at the moment, we are looking to interlink this database with the ID pool database to actually connect with people with disability database. Next slide, please. So the future of Cambodian social protection framework in terms of disability inclusion is right now we are looking into the family package setup. At the current moment, we are still handling providing the COVID-19 cash transfer support, while I mentioned earlier. But in the future, we'll be looking to phase out a bit further. But likely will not be in terms of people with disability. The number will still maintain in terms of the benefit, likely to be expanded. And in terms of the amount of number of the people with disability also would be expanded. So this is a very strong encouragement from our government to support our people with disability in Cambodia. At the same time, the database that we allow is promoting the response of the need with the social economic recovery and also help accelerated access to COVID-19 vaccination. And further expansion of the coverage of the person with disability through disability identification mechanism is also a support for all the services that are actually connected that we are working together with the private sector and all the sector involved. So thank you. I think I'm just on about our time. Next slide, please. And I hope that this information will be helpful to everyone. Thank you.
Thank you very much, Mr. Barros, for sharing with us an excellent example from Cambodia in using a digitalized system to support data collection and cash transfer to make it more efficient and also transparent. Now, with that, we would like to move to another country example. Our speaker is Mr. Mamadou Lamin Fati, Director of the Promotion and Protection of Persons with Disabilities at the Ministry of Health and Social Action, Senegal. Mr. Fati, please.
Merci beaucoup. Donc, je voudrais vous remercier de m'avoir invité à ce webinaire international sur la protection sociale. Je vais mettre l'accent sur le résumé de l'étude diagnostique réalisée par le Bureau international du travail en 2021 sur la carte d'égalité des chances et terminer ma communication par des perspectives de cette étude diagnostique. Alors, pour ce qui est de la carte d'égalité des chances qui constitue le fond de ma communication, il s'agit d'un filet social multisectoriel adossé à 7 services. Donc, des services de santé, des services de réadaptation, des services éducatifs, des services financiers, des services de transport et des services relatifs à l'emploi. Cette carte, donc, a 2 grandes fonctions, une fonction d'identification de la personne handicapée et une fonction de protection sociale. Cela signifie que la carte d'égalité des chances est un outil statistique extrêmement important. Et sur cette diapositive, vous avez le spécimen de la carte d'égalité des chances avec la photo de la personne handicapée, les éléments d'état civil, la codification du handicap, la région de provenance. Et vous avez un système de QR code pour identifier la personne handicapée dans une base de données. À ce jour, donc, au Sénégal, on a produit 69 289 cartes d'égalité des chances. Cette carte, donc, est rattachée à des filets sociaux. Également, il y a des services de cash transfert. Par exemple, pour ce qui concerne les services financiers, il y a un montant, donc des cash qui sont transférés annuellement aux personnes handicapées qui sont détentrices de ces cartes-là. Alors, pour ce qui est donc de l'étude menée par le BIT sur le programme de la carte d'égalité des chances, c'est une étude qui met l'accent sur quatre grands domaines. Hein? Donc, diapositive. Alors, d'abord, l'étude met l'accent sur... Donc là, vous avez, il y a un retard, le spécimen de la carte d'égalité des chances. Next slide, please. Next. Prochaine diapo, s'il vous plaît. Voilà, donc je disais que l'étude menée par le BIT sur le programme de la carte d'égalité des chances met l'accent sur plusieurs points, notamment la réflexion pour un régime de pension universel qui serait ouvert à toutes les personnes handicapées détentrices de carte d'égalité des chances. Également, l'étude met l'accent sur la budgétisation d'un programme pour l'accès beaucoup plus important des personnes handicapées à la carte d'égalité des chances. Et également, l'étude recommande qu'on puisse uniformiser le système d'évaluation du handicap à tous les niveaux donc des services de prestations sociales. Également, autre recommandation phare de l'étude qui consiste donc à améliorer l'instrument national de mesure du handicap du Sénégal. Il y a d'autres recommandations qui portent sur la mise en œuvre de stratégies avancées. Donc, c'est quoi une stratégie avancée? Dans le cadre donc, du dispositif organisationnel du programme, donc, il faut savoir que dans les différents départements du Sénégal, au Sénégal, nous avons 46 départements. Dans chaque département, il y a des commissions ethniques qui sont chargées d'instruire les demandes pour mettre en œuvre la carte d'égalité des chances. Et donc, ces commissions-là travaillent avec les localités les plus élevées, les plus éloignées, pour inscrire les personnes handicapées au programme. Alors, next slide, please. Alors, d'autres recommandations également portent sur l'interopérabilité du système d'information de la carte d'égalité des chances avec d'autres systèmes nationaux. Alors, au Sénégal, nous avons un registre qu'on appelle registre national unique qui centralise toutes les données relatives à la protection sociale. Et l'étude recommande que la base de données de la carte d'égalité des chances puisse être connectée avec le registre national donc unifié des cartes d'égalité des chances. Autre recommandation toujours liée au système qui consiste donc à procéder à un archivage numérique donc de l'ensemble des dossiers relatifs au programme, mais également de digitaliser complètement toutes les étapes du processus de production de la carte d'égalité des chances. Donc, il faut dire que dans les étapes, il y a aussi des étapes qui sont manuelles. L'étape de numérisation, c'est pratiquement l'étape ultime où, lorsque nous avons les dossiers, nous procédons à l'enregistrement numérique des demandes d'égalité, des demandes de carte d'égalité des chances pour ensuite imprimer les cartes et les rendre à leurs bénéficiaires. Autre recommandation non moins importante de l'étude qui consiste également à procéder à un reporting annuel des progrès réalisés par le programme de la carte d'égalité des chances. Je rappelle que ce reporting annuel se fait donc dans la réalité. Chaque année, il y a une évaluation des performances du programme de la carte d'égalité des chances. Alors, pour ce qui est donc des défis et des perspectives, au Sénégal, donc ce programme-là de la carte d'égalité des chances qui est, je le rappelle, institué par une loi et réglementé par un décret présidentiel, nous voulons donc le renforcer donc, dans le cadre d'un programme ambitieux sur la période 2022-2026 en collaboration avec le ministère de l'économie, du plan et de la coopération. Également, donc, autre défi important, nous comptons mobiliser des ressources avec les partenaires, donc, dont le BIT, pour le cofinancement donc, du programme de la carte d'égalité des chances. Déjà, le programme que nous sommes en train d'élaborer est budgétisé prévisionnellement à hauteur de 2,5 milliards de francs CFA. Mais ensuite, il va falloir donc mobiliser les ressources pour le financement justement de ce programme. Et dernièrement, le troisième défi que nous avons à travers ce programme, c'est de voir comment internaliser et décentraliser la gestion du programme par l'Agence informatique nationale de l'État. Donc, parce que jusqu'ici, le programme, nous collaborons avec un consultant qui gère la base de données du programme. Nous voulons donc que cette base de données soit gérée intégralement par l'État, sous la supervision de notre ministère de tutelle. Également, autre aspect important, c'est de numériser complètement toutes les demandes formulées par les personnes handicapées pour obtenir la carte d'égalité des chances. Et nous voulons également, dans le cadre du nouveau système, certifier le handicap souffre. Donc, pour permettre un accès beaucoup plus rapide des personnes handicapées à la carte, parce que parfois, on avait remarqué qu'il y avait des lenteurs pour obtenir la carte d'égalité des chances. Donc, si on génère un certificat de handicap, même en format papier, cela peut permettre à la personne handicapée d'accéder aux services auxquels cette personne handicapée a droit. Et enfin, nous voulons également mieux réorienter les missions des commissions techniques. J'avais parlé de 46 commissions techniques qui gèrent le dispositif organisationnel de la carte. Nous voulons également mieux orienter les missions de ces commissions techniques qui sont réparties à travers le pays. Donc, voilà un peu de manière ramassée les éléments de ma communication qui mettent l'accent, comme je l'ai dit, sur les résultats de l'étude qui a été menée en partenariat avec le BIT au Sénégal. Et donc, toutes ces recommandations sont intégrées dans un document de projet que nous sommes en train de finaliser pour le mettre en œuvre. Merci beaucoup.
Thank you very much, Mr. Fati, for bringing us the example from Senegal, and especially also you. Okay, let me turn on my video. Yes, and you also highlighted the importance of digitalization and how it supported your program, and through your program, how person with disabilities benefited from improved access to health services, financial support, etc. Excellent example. And I can see that a lot of questions are coming up for our speakers from Cambodia and Senegal. Our speakers may wish to type answers, and I'm hoping I will have a bit time for Q&A after we finish all the presentations. Thank you. You can keep asking questions and post it in the Q&A feature. Now let's move to our next speaker, Mr. Marcel Muraicha, Disability Management Information System Project Manager at the National Council of Persons with Disabilities, Rwanda, to make a presentation on the Disability Management Information System in Rwanda. Mr. Marcel, the floor is yours. Mr. Marcel, are you ready? You may begin your presentation.
Hello,
yes.
Everyone. So let me try to share my So thank you very much. I'm Marcel Muraicha from Rwanda. I'm going to present to you the Disability Management Information System from Rwanda. I work at National Council of Persons with Disability. First of all, I wish to tell you about the disability issue in Rwanda. We have lack of disability data, although UNCRPD was ratified, while UNCRPD was ratified the medical model once, only once 5 years ago. Lack of knowledge about barriers and needs of persons with disability, lack of support to persons with disability who are most in need, absence of use of international validated instrument, children with disability under 5 years not captured in data collection, disability not linked to social protection. So in order to address the higher issues, the government of Rwanda committed to start using disability management information system. this is how the system will work. This is the disability assessment tool or disability questionnaire into a tablet, which will be used copy. And this is a registry, disability registry, which will use the DIHS2. The disability registry will generate a digital limitation profile together with interactive dashboard and the case management support. This is the questionnaire content.
Mr. Marcel?
I hear you.
Yes,
yes,
we can hear you. Can you put your slides in a slideshow mode? It's easier for the participants to see.
Okay, thank you. Yeah. So, I was sharing the questionnaire content. I was on the third questionnaire content, which is assistive devices related, personal assistant information, school environments. The fourth one is barriers and met needs and priority based on CBR or CBID areas. So this questionnaire, it will include the first one, as I explained in the previous slide. The first one, which is demographic information, will have information related with the province, district, sector, contact data, the categories like economic status, issue, gender, age. While the second one, which is related with the Washington questions for adults and the children. Children, it's about 5 and 17 years, 3 to 5 years, and the milestones of children below 2 years. So the third questionnaire content it's related with the which are the additional questions. It's around 18 questions on assistive device, personal assistant, cause and the level of limitation, albinism, short statures, environment, well-being, in school environment and out of school environment for children between 6 and 12 years. So the content question 4 is question related about barriers, unmet needs, priority in community-based rehabilitation in each 5 areas: health rehabilitation, education, livelihood, social life, and empowerment. This, as I mentioned already about limitation profile degree, the system will help us to show the limitation profile for every person with limitation, which will be accessible through the system, where everyone will be able to access him in both Kenya and English. So the level of limitation. For the second one, I will talk about interactive dashboard. This is the dashboard which will be generated by the DMIS Disability Information System. It's like about 6 features, which are general overview, social and demographics, health and rehabilitation, school and education, employment and livelihood, social life and environment, and as related with the limitations about Washington group questions. We have like hearing, seeing, mobility, remembering and concentration, self-care, and communication. Those are the the possible features which will be generated. Case. I hear you.
Yes, we know that your internet may not be so stable. You can turn off your camera just to make sure the sound can come through clearly. Okay. You can turn off your camera.
Okay, let me see how I can, together with the.
Yes, please go ahead.
My presentation. When I put my, now you hear me? Okay, thank you. Thank you.
Yes,
so now I'm going to tell you about, okay, case management. For case management, now the case management, this is a framework of case management where it is in 4 steps, where it will help us to identify vulnerability and propose action. It will help us again to make a support like referral and to make like monitoring of progress of of support. So this agreement will be made. It is an individual support plan in terms of health and rehabilitation, especially in assistive devices or any medical related issues. In terms of education, it will has to know environment, people who with a disability, with a formal, no formal education. To know the number of persons with disability in the TV, to assess impairment. So for social life, it can show us the personal assistance. So in empowerment, see how about the community support, political participation linked with organization of a person with disability, and for other possible information. So those are the DMIS features and the benefits. The benefits for the disability management information system, it will help us to have history, real-time dashboard and map on indicators. It will help us to make like case management support for the most in need person with disability. It will be linked with the other database, including social support. It will help us to check an individual limitation status. It will have information on grievance and the appeal system. It will help us to know the limitation profile for possible benefits and disability information for research purpose. So the possible information will be there so that for research purpose it will be used. It's again will help us to make a comparison with census data from. This is the benefit from using our disability match. Do you hear me?
Yes, thank you, Mr. Masso, for sharing with us the experience from Rwanda. I think the disability management information system you presented is really comprehensive, especially in terms of the detailed case management, allows all aspects of the person with disabilities to be reflected in the system. I think this is another excellent example. Finally, we are coming to a fourth country example from Mr. Jeffrey Lizardo, General Director of the Unique System of Beneficiaries, Dominican Republic. He will focus on the inclusive social protection management information system in the Dominican Republic. Mr. Lizardo, please. Mr. Lizardo, you may start.
Sí, muchas gracias. El sistema, ¿me escuchan?
Yes.
¿Me escuchan bien?
Yes, we can hear you.
El Sistema Único de Beneficiarios es una institución que fue creada en 2004 en la República Dominicana para identificar, caracterizar, registrar y priorizar a las familias en condiciones de pobreza. Es un sistema de información social que ordena a la población y a los hogares a nivel nacional de acuerdo con su situación socioeconómica y de vulnerabilidad. Es un instrumento de carácter técnico que se utiliza para mejorar la asignación de recursos públicos a la población con mayor vulnerabilidad, haciendo más transparentes y eficiente dicha asignación. También permite la identificación temprana de riesgos diversos en los hogares, contribuye a la adaptabilidad de los programas sociales ante cualquier choque como el de la pandemia o los generados por el cambio climático. Permite monitorear y evaluar el impacto de las políticas públicas. Ahora bien, ¿cómo lo hacemos? ¿Puede pasar, por favor, la siguiente slide? El siguiente.
Mr. Lizardo, it seems your sound is not stable. Maybe it's better
¿No es muy bueno?
Yeah, maybe you turn off the camera. It would be better.
Sí, sí.
Yes. Yeah.
Okay.
Okay.
¿Cómo hacemos el trabajo? ¿Se escucha mejor ahora? ¿Se escucha mejor?
Yes, you
Sí,
can go
hola.
ahead.
¿Se escucha mejor? Ok.
Please
¿Cómo
go ahead,
hacemos el
Mr.
trabajo?
Lizardo.
Primero, para conformar el registro, hacemos censos nacionales por barrido en áreas priorizadas en el territorio nacional, de acuerdo al mapa de pobreza, cada 4 años. También hemos incorporado otros mecanismos como centro de atención telefónica.
Mr. Lizardo,
Estamos
your
integrando
sound is
también
Mr. Lizardo, your sound is
la
very low.
autodeclaración.
Can you raise the
¿Sigue
volume?
siendo muy malo?
Yes. Okay.
Sí.
Can it be slightly?
Y ahora, ¿se está escuchando mejor?
Okay. Okay.
¿Se escucha mejor? Sí.
Okay, it's better now.
Ok. Entonces, estamos integrando datos de los registros administrativos vía interoperabilidad para actualizar los datos. ¿Cómo categorizamos los hogares? Nosotros utilizamos varios índices. Uno de ellos es el índice de calidad de vida, que permite hacer un estimado de la pobreza estructural de los hogares. Tenemos también el índice de pobreza multidimensional, un índice de vulnerabilidad, choques climáticos y un índice de ingresos. ¿Qué hacemos para ordenar a los hogares? Cada índice le da un ranking, un número de 0 a 100 a los hogares y eso permite ordenar a los hogares desde lo más vulnerable a lo menos vulnerable. De esta manera conformamos el registro social de hogares cuya cobertura actual es del 62% del total de la población. Puede pasar el próximo slide. El próximo slide, por favor. Bueno, sí. Tenemos una cobertura del 62% y ahora estamos ampliando esa cobertura para tener un registro universal y tener alrededor del 85% de la población. Y es que la pandemia del COVID demostró la importancia de un registro o sistema de información social como el SUBE, ya que en cualquier momento toda la población puede ser usuaria de los programas sociales del gobierno. Para la conformación del registro, utilizamos un cuestionario de caracterización socioeconómica de los hogares y en el mismo se aplica el modelo del set corto del Grupo de Washington para la medición de la discapacidad. Esto nos ha permitido tener un registro confiable de personas con discapacidad según el dominio de funcionamiento y el grado de severidad. El registro social de hogares es la fuente única para determinación de los hogares elegibles para las transferencias monetarias condicionadas en el país. En el contexto de la pandemia, este registro permitió de manera rápida y eficiente la ampliación de los hogares receptores de las transferencias monetarias y la priorización asignando mayor cobertura y transferencia a los hogares con niñas, niños con discapacidad severa, gracias al apoyo de la cooperación internacional, sobre todo en particular UNICEF. La próxima, por favor. Próximo slide. El registro cuenta con 464,000 personas con discapacidad, lo que representa el 7.3% del total de la población empadronada. Aplicando la metodología del Grupo de Washington, el 8.1% de las personas con discapacidad tiene un alto grado de severidad. El total de hogares con personas con discapacidad que reciben las transferencias monetarias es de 154,000 hogares. De estos, 20,000 hogares con niños y niñas con discapacidad severa. El último slide, por favor. El último slide. Tenemos desafíos y tareas pendientes. Solo enumeraremos las tres principales. El primer desafío es la necesidad de fortalecer la interoperabilidad con bases de datos administrativas para la actualización permanente del registro social universal de hogares y el registro único de beneficiarios, porque esto generará mecanismos más eficientes y rápidos para la identificación y actualización de los registros de las personas con discapacidad. Permitirá el aumento de la cobertura poblacional de los registros y apoyará al Consejo Nacional de Discapacidad en la puesta en marcha del sistema de valoración, certificación y registro continuo de la discapacidad. Segundo desafío, impulsar el uso de los registros de personas con discapacidad para la asignación de beneficios en las políticas públicas. Y el tercer gran desafío es impulsar el monitoreo y evaluación de las políticas de inclusión social y económica de las personas con discapacidad, con el registro social de hogares y el registro único de beneficiarios. Esto apoyará con la implementación del artículo 33 de la Convención sobre los Derechos de las Personas con Discapacidad. Ahí termino. Muchas gracias.
Thank you very much, Mr. Lizardo, for sharing the example from the Dominican Republic. So another excellent example on the information system focusing on social protection management. You also raised important questions in terms of challenges, including MNEs. I hope perhaps our next speaker and final speaker for this session, Alex, could help address some of the issues and challenges you raised. Alex who is the social policy specialist on disability and social protection with the UNICEF. He will make a synthesis presentation on disability assessment and determination, CRPD compliance, as well as diversity in diverse context. Alex, please, the floor is yours.
Thank you very much, Chai, and thank you to all the presenters before. They made my job much easier. We have been working with UNESCAP, ILO, within the frame of a project with UNPRPD to look at what have the countries been doing, and some of those countries that we have looked at in details we are presenting today. And we have looked at how disability assessment have been used during the COVID-19 as a first step. And we saw that indeed it has been very difficult for countries that did not have disability registry or inclusive social protection information system like in Dominican Republic to carry out disability assessment in the middle of crisis. And this has prevented horizontal expansion of support to persons with disabilities. We have seen also that there are issues in investing in comprehensive national individual disability registries, but more and more countries are moving towards that. And we saw example of Cambodia and Rwanda. But the very important element is what kind of information provide the disability registries. And very often they provide very little information. They say this person has a disability level 1, 2, or 3, but it doesn't say anything to the system about what are the support needs that are needed. And the way they are built often do not enable coordination across sector. So one of the things that we've looked at is what are the drivers for the reform of the development of disability assessment and determination mechanisms. And they can be diverse. It can be like in Fiji, setting up eligibility determination for a first disability benefit because there was no such benefit before. It could be like tackling suspicion of widespread fraud, like in some of Europe and Central Asia country. It could be the shift to the CRPD paradigm, where we know that the disability assessment do not provide information on the support needed. But it could be also that we realize that not enough people access the mechanisms. And one of the key questions that we discover as we work is that there is a fundamental issue of defining what are the benefits and services needed by persons with disabilities that should not require disability status. We heard yesterday, for instance, about healthcare and assistive technology being part of universal health coverage, and what are the benefits that are supposed to be under disability status. And this balance between universally covered services within mainstream program and benefits and services subject to the disability status, this balance is very context specific. Another issue that we have identified is the importance to make the difference between the disability assessment, which is the collection of the information about the person's situation, the disability determination, which is the official decision to grant the status of person with disabilities to an individual, and eligibility determination, which is based on those different elements, deciding who will get what kind of services. And if we look at the disability assessment, and we heard from our colleagues, very often, initially there was assessment of impairment or medical condition. And now we heard that countries are moving, including functional difficulties, basic support needs, but also the barriers at home or in the community, the level of support currently received, and ultimately the level of participation of the person with disabilities. And this assessment should inform eligibility determination, case management and referral, as pointed out in the Rwanda case, but also policy planning at local and national level, bringing data that governments rarely are. And a part of this process is the disability certification and determination. So the challenge that countries are facing, and I think Al-Radi at the beginning really highlighted that, which is how do we ensure that the system is easily accessible everywhere in the country for persons with disabilities. It is comprehensive, which means it provides the information we need, not just impairment-related information, but also it's age-appropriate. And we saw the need to have children-specific assessment and adult-specific assessment. And for the government, there are clear issues with regards to reliability, limiting fraud and complaint, ensuring that wherever the assessment is done, it will yield the same result. For persons with disability, issue of accountability, transparency, and grievance mechanism are very important. And what we've seen is that when countries try to solve one aspect, it creates tension with another aspect. And each country has to find an equation. And we saw, for instance, Cambodia trying to really balance all those different elements to build their system. So I just want to highlight few elements that we saw as being really challenging in terms of balance. For instance, some countries really want to have medical certificate because they believe that it prevents fraud and will ensure that real people with disability, if I may say, are accessing benefits. The problem is that in most countries, there is not enough accredited staff to cover the country, which limit access. Another issue that we've seen is, yes, we want to know more about persons with disability and their support need, and we need multidisciplinary teams. And it's true that it helps make comprehensive needs assessment. The problem is that in most low and middle income countries, there are not such staff everywhere, and they are often available only in big cities, which really reduce access in remote areas, especially for people who need the most support. A procedure that is used in some of the countries we heard of, which is, for instance, community verification of applicant list for the disability card. It's indeed a practice in social protection, which helps reliability of the process, but in the other hand, from a CRPD perspective, it may be a breach of the rights of privacy for persons with disabilities. Another element is one-stop shop at community level for a better access to assessment carried out by community level workers, which is a very good practice, but sometimes it can create lack of trust from different stakeholders in ministries because they may doubt the reliability of the process. So we came out with 5 key points to consider in building such system that we learn from the different countries. The first one is, what is it that we need to change in the current mechanism? Is it a problem of access? Is it a problem of comprehensiveness of the assessment? Or is it a problem of reliability? Or a bit everything? The second question is, what are the human resources that are available at local level that could carry out a disability assessment? Because if they are not available at local level, then whatever assessment is done, it will not be accessible for most people with disabilities. But once you have defined that, you need to think, what are the mechanisms that we can use to exert quality control and fraud prevention while maximizing access and optimizing comprehensiveness. And this is, for instance, the validation system, digitalized validation system that Cambodia has put in place, which is one example. Ultimately, the question is, now that we have assessed those issues, what are the tools that we can use to build a country-relevant instrument for disability assessment that will be in line with the CRPD? And what is critical, and we saw that in different countries, is the importance to do all this work in consultation with organizations of persons with disabilities, as well as the different ministries that tomorrow will provide benefit based on the disability assessment and determination, so that they have trust in the system and strong ownership over the system. Thank you very much.
Thank you very much, Alex. In your shorter presentation, you managed to cover a big topic and provided a comprehensive summary of various aspects concerning disability assessment, disability determination, and how to unbundle them, and also illuminate the various contexts and possibly how do we address the different scenarios. I think right now we still have a few minutes to perhaps just pick up some questions. A few questions raised by participants have been addressed by our panelists. Right now, maybe let me pick up first one question related to data privacy issue. Several of you mentioned this question in Q&A, and this can be addressed by any panelist who feels comfortable to address the issue. The question is, can you share any issue related to data privacy on data sharing to other government agencies and offices, and how it was handled? And also in terms of this data, how sensitive in terms of listing specific categories of people who are to make sure they are protected. Any panelist would like to quickly address this question?
Sí,
Mr. Lizardo?
¿Me escuchan? Puedo responder. En el caso de República Dominicana, nosotros, la gestión ética de datos es un tema que estamos visibilizando como sistema de información social, y para el intercambio de datos y proteger la confidencialidad y la privacidad de los datos con agencias gubernamentales, se firma un protocolo entre ambas instituciones, donde la institución que reciba la información tiene que garantizar la confidencialidad en el manejo de los datos.
Thank you, Mr. Lizardo, for addressing that question. There's one question for Mr. Marcel regarding Rwanda. What are the institutional arrangements of the system? Who is leading? Who is registering? Mr. Marcel, could you address the question?
Yes, I hear you. The system is under development by National Council of Persons with Disability, which is under Ministry of Local Government, and the data collector of in the system will be the trained person with disability. And the system will be linked with the other existing system, especially that one of social protection, health management information system, so that the minister, for example, Minister of Health, can access information related with the assistive device, so that the ministry can make a proper planning to respond to the needs in terms of assistive device. And the social protection, which is provided by another institution, can access information through the connection of the system to provide social protection system. Thank you.
Thank you, Mr. Marcel. Dear participants, we reached the end of this session. In case your questions are not addressed, you will receive responses from your email. We hope to address everyone's questions after the conference. With that, I want to express our deep appreciation to all the speakers for this session who have showed us how to deal with various challenges in different contexts. But they were all trying to to develop a comprehensive system. And perhaps the solutions can still be further evolved. And the joint paper we are working on, as Alex have mentioned, we will later on be released and also provide further insights based on good practices we collected from around the world. Thank you again, dear participants, also for sharing your comments and questions. We hope you benefited from the insights of all of our speakers in this session. The final session will begin in about 10 minutes, actually 8 minutes, focusing on very important issues, how to address the financing gaps and the way forward toward developing universal social protection for persons with disabilities across the life cycle. You are all invited to join the final session. Look forward to seeing you there. Thank you very much. Bye-bye.
Okay, thank you.
Thank you. Thank you to all the speakers. So this session has come to the end. Thank you. See you at the next session.